So we're here to discuss two scientific papers that were essentially meta-analyses of the cranial paradigm and the visceral paradigm. So they are both titled The Reliability of Diagnosis and Efficacy of Visceral Treatment and of Cranial Treatment. And they're linked to down below. So you should take a look at them to understand what was actually going on in these papers. And essentially what they did is they did a big broad search. They found a bunch of papers on cranial treatment and they found a bunch of papers on visceral treatment. And what they found very, very broadly was that there is no strong signal for the efficacy, the reliability of diagnosis or the efficacy of either paradigm, be it cranial or be it visceral. They also, within their design, within the study design, which was a meta-analysis of papers that already exist, they had a very strong inclusion criteria and a very strong exclusion criteria. So papers that didn't kind of come up to snuff, they weren't even utilized. With the papers that they did include, which were not very large in number compared to the number that they found, what they also identified was a very high likelihood of bias from the authors of the papers. Now, when you have a very high amount of bias within these papers, it's suggesting that the interpretation of the results is probably not ideal compared to what the data is actually presenting. What it's suggesting is that the people are probably pushing their paradigm, pushing their belief through the results that they're presenting or through the way that they analyze it. Now, what this suggests with respect to these two paradigms, so the cranial and visceral paradigm, is that, again, we don't have a very strong signal for the efficacy or the reliability of these paradigms within a clinical setting. So it is at least suggestive from this viewpoint that they're not very clinically relevant as they stand. It's also suggesting that the people writing these papers have a belief and they are trying to push it. So they're trying to find a way to prove what they already believe. And it's not the most appropriate way to go about studying something. You're supposed to have a hypothesis, you're supposed to frame a question to find information. You find that information, you analyze the data, and you see what it says. And it says what it says. Obviously, you get to the point where people are saying, well, the way that you analyze data, you can kind of make it say anything you want, and that's the problem. The problem is that there will be people who try to skew the data or skew the analysis to their benefit. But if you're doing that, other people will know because they understand how to analyze data, and they'll see that the way that you claim you analyze the data is leading to your biased findings. So what we have within the osteopathic world or the osteopathic community is the concept of cranial and the concept of visceral, and they're held up as these high-level paradigms or these high-skill paradigms because you have to have greater skill. While it's at least possible, you want to keep your mind open and say that there may be things happening that I don't understand. When looked at, we don't get a strong signal back that that's true. The idea that people are identifying organs and how they're moving through skin, through adipose tissue, through multiple layers of the muscular abdominal wall, and then hidden behind other organs from time to time, and to suggest that they are accurately identifying what's happening with an organ is just not particularly tenable. I think everybody would have a willingness to agree with that, aside from the fact that many people believe that it's this high-level skill. So they've been told something, they believe it, and they attempt to perpetuate because somebody smarter than them or somebody who's been doing it longer than them told them, and they want to be like that person. What we're seeing with that is something that I've talked about, or what we're probably seeing, not absolutely, but what we're probably seeing is that somebody's identified a phenomenon, clinically speaking. They have identified that movement is different on one side of the abdomen than the other. There's stuff that lives there, so they will claim that it's because of that thing. Well, it could just be because that person has a long-time movement bias through repetitive actions. But if you find something in and around the common costal margin, the inferior costal margin, the common costal cartilage, on the right side, you may believe that something's going on with the liver or something's going on with the gallbladder. But by today's standards, as far as claiming that something's going on with an organ, well, if you have some palpatory suggestion or some rebound tenderness upon palpating the abdomen, then what you would want to go and do is you would want to go and do blood tests, you would want to go and do images, and then If you find information that suggests that there's a problem with the organ, then there's a problem with the organ, or there's cause for further investigation to prove that there's something going on with the organ. Simple palpatory diagnosis on the abdomen isn't acceptable in a medical context, or in the context of somebody who's going to perform surgery, or in the context of somebody who's going to be an oncologist. It's not acceptable. You need more evidence. We know you need more evidence because we've gone out and we've searched and we've proved that you need more evidence. Same thing with the head. The paradigm within the cranium is that the naming convention surrounds the spheno-basilar joint, which we know is an anatomical fallacy because by the age of 14, the spheno-basilar joint is considered fused, and from the day you're born until the day you're 14, this isn't obviously exact, but there's a process of fusion. It's not something that should be moving. So the thing that somebody is feeling when they hold the head, when they touch the head, may be a strain pattern. It's entirely possible that it's a strain pattern, but it's not likely happening or driven at the spheno-basilar joint. The spheno-basilar joint is probably not worth discussion because it doesn't move, especially in the majority of your patient population. Is there a strain that exists? Is there a musculoskeletal element? Probably, but it's probably not coming from inside the head. The information to suggest that there is, that's perpetuated within multiple cranial paradigms, is not tenable. It's not something that we should really be giving the time of day because it's been proven to be incorrect. Now, what we are likely dealing with again here is the concept, and I've touched on this before, the concept of theory-induced blindness. So what ends up happening clinically, somebody identifies something, a phenomena. They identify a way to consistently interact with that phenomena and change that phenomena. And then they tell a story surrounding it to transmit it to others so that they can perform the same thing. The problem is that that story is very likely incorrect as far as the mechanistic portions of it. It's not that they haven't identified a phenomenon and are not able to control the phenomenon. They are. But they tell a story that's probably not valuable or probably not tenable, aside from the fact that it allows other people to continue to control that phenomenon, whatever it may be. When we start to look at it and when we start to assess it with strong criteria, with strong research criteria, we tend to get information back that is not supportive of our viewpoint of the story. When it's not supportive of the viewpoint of the story, we will then start to have arguments such as, well, the problem with science is that it can't accurately describe what's going on. Well, no, that's not true. It can. It's just it's not supporting your view, your belief. So there are people that will suggest there was a split between the Cartesian system and the Goethian system, and that the Goethian system is more appropriate for studying osteopathy. And I wouldn't necessarily agree with that. I'm not against the idea, it's all fine, but what I'm suggesting is that the idea that there's this split may not be of value, because the Goethian system, as far as I understand it, and maybe I'm wrong, is essentially suggesting that we are the instruments of measurement, and we know, we can prove day in, day out that we're not reliable at measuring. We're not good at, as humans, our nervous systems are the way that we're built. We are poor at measuring things. It's provable. So what I'm going to suggest here is that when we are telling a story, or when we have something within our culture that we like to talk about and perpetuate, and when somebody breaks from that, or when somebody studies it and says, no, the story you're telling probably isn't right, there's no strong signal for it, we will then say your science is bad, or we will start to attack that concept and say it's incorrect. It's not incorrect. It's just asking a question, getting data, and giving answers to that question. You can't give an answer to a question that isn't asked. So what I will say is that the concept of cranial and the concept of visceral probably have reliable and reproducible phenomena, but not to what they claim they are doing. It's probably not doing anything to the cranial bones when you're doing cranial work. Very unlikely. Not impossible, but very unlikely. You're probably not doing anything to the organs in a measurable or useful way when you're working within the visceral paradigm. You are probably helping motion of many things when you're doing this work as a practitioner, as a manual practitioner, but you are probably doing none of what you claim you're doing. That is the signal that we're getting back. You're doing something. You're not doing what you think you're doing. We're probably dealing with theory-induced blindness. You believe the theory, so what you do is you go ahead and you design studies to try to prove yourself right. It's not what we should be doing. essentially stated that in a different way earlier here. What we want to look at is, we are doing something. We need to start to try to figure out what we are doing, as opposed to trying to prove that we are doing what we think we're doing. I would suggest that there is something happening with manual therapy regularly, whichever paradigm you want to talk about, whether it's a craniosacral, whether it's a Sutherland cranial, whether it's a Becker cranial, whether it's a Barral style visceral kind of paradigm, doesn't matter. Something's happening. Probably not what you think is happening. And when information comes back from strong and well designed research that doesn't support your belief, that doesn't mean it's wrong. It doesn't mean that there's another method that would prove you right better. Stop looking for the method that would prove you correct. Start looking for what's actually happening, not what you want to be happening, not what you want to be correct. So taking these two meta-analyses allows us to understand that the way that we've been attempting to do this is highly biased, and it's showing no reliability for the claims that are being made. Again, something is probably happening when people are working within a cranial visceral paradigm, but again, not likely what you think is happening. So my hope and my aim is to have this discussion. Whomsoever watches it is wonderful, but to suggest that we start considering zooming out and saying what is happening is not what we think is happening, but we can start to identify what is happening as opposed to what we think is happening. And that's very important. We don't want to continue to try to reiterate and prove things that are being proven wrong, because then we look like we're just holding on to old information, and we look like, well, essentially we're ignoring the reality that's being presented in front of us. So again, start to consider that what you are doing may not be what you think you're doing, and that's not a problem. The problem is when you insist that what you think you are doing is what's happening when you're being proven wrong. So these two papers allow us to have that discussion, allow us to begin to have that discussion and say, okay, maybe what we need is people who are more savvy at creating research to identify what is happening, and that don't listen to our preconceived notions and our preconceived stories, because they are starting to make us look bad as a profession.